Calls to crisis centers in Pennsylvania are up a little more than 2 months after that new 988 hotline to access mental health services rolled out nationwide.
But these services are clearly needed, but can the centers keep up with call volume? Sonica Bargo joins us with our top story tonight. Sonica.
Dennis, Alicia, the Department of Human Services tells me call centers in the state have actually improved their response since that 988 hotline rolled out. The goal of the hotline is to give people an easy way to quickly access mental health services, and it seems to be working. When the 988 Suicide and Crisis Lifeline rolled out in July,
there was a 45% increase in calls.
Human Services Deputy Secretary Kristen Hauser-Rapp says at first people just wanted information.
There were an increase in curiosity calls.
But 2 months later, call volume remains high. In August, calls received in Pennsylvania jumped by more than 20% compared to June before the rollout.
Our call centers are doing a great job of answering the calls that are coming in from Pennsylvania numbers.
Local crisis centers echo that trend. Lancaster Behavioral Health and Development says calls have jumped nearly 50% above their average. Hauser says calls aren't the only thing they handle.
If somebody needs a mobile response, they're the ones who they'll hang up the phone and they're going out on that mobile team.
But call centers are handling the influx. 86% of calls received are answered in state, up from 79% in January.
We have a Pennsylvania safety net before somebody needs to roll over to the national backup.
Hauser says calls can actually be routed to multiple centers in Pennsylvania before hitting the national network. It's important call centers in states know how their specific resources work.
If the mobile team is operated by a different organization, then they know how to get it.
Hauser admits call centers are facing some challenges.
The call centers are really looking for additional staff.
But she says they're still there to meet people's needs.
If you're feeling like you're having an emotional crisis, you're feeling overwhelmed, you're feeling scared and like you need some assistance, we want you to call.
Hauser also tells me there could be more funding coming to crisis centers soon. A behavioral health commission is working on recommendations on how to spend $100 million on mental health, and crisis services are part of that effort.